I'd like to introduce our first physician. This is Dr. Thaed Ahmed. He has been I've known him through AMP for well over 15 years now, but he's an attending physician in the Department of Emergency Medicine at Advocate Christ Hospital. He's also the Assistant Residency Program Director and the Global Health Director at Advocate Christ in their Emergency Medicine Department. He is a Med Global board member, and he has been to Gaza in 2008 and 2009 prior to this visit this year. Next up, I have on Dr. Thaed, it is right, we have Dr. Zahir Sahlul, very familiar to our community. He was the former president of MAS Foundation and of CIOGC, the Council for Islamic Organizations of Greater Chicago. He is also the co-founder and the president of Med Global. This was his fourth mission to Gaza, and he is currently an associate professor at UIC in pulmonary and critical care and specialist at Advocate Christ Medical Center. To his right is Dr. Chandra Hassan. He is an associate professor of surgery in the Division of General Surgery, Minimally Invasive Surgery, and Bariatric Surgery. And he is also the director of the Bariatric Surgery Program and Minimally Invasive Fellowship and Bariatric Fellowship at the University of Illinois in Chicago Hospital. This was his first medical mission to Gaza. And then all the way on the far right, we have Dr. John Kaler. He is a retired pediatrician, but he is one of the co-founders of Med Global and one of the founding board members. And he had been to a medical mission in Gaza in 2018 prior to this one. That being said, for all of the panelists, I'll have you speak for a few minutes, and then there's a couple of questions that we have prepared from the audience, and then we'll go from there, inshallah.
Okay, assalamu alaikum. Alhamdulillah wa salatu wa salamu ala rasulillah. I want to first start by thanking everybody in this room. I felt a lot of support when I went to Gaza, and a lot of reached out to my family, reached out to my mom and my wife, and texted me, making sure I was doing okay and asking about the people there and how they can help. So I truly felt like I was a representative of this community, specifically when I went to Gaza. And I felt that it was important to share that. There's a lot of people who care about what's happening in Gaza. There is a whole community behind me that wants to know what's going on. And I know that this crowd is very familiar with the numbers, is very familiar with the tragedy, knows what's happening to the people in Gaza. So what I want to do is I just want to share my personal experience. I want to share what we saw on the ground, things that I think you guys will be able to put together. So me and Dr. Hassan here, Dr. Chandra, went to, on the first day that we were there in Gaza, we went to Khan Yunis and Nasser Hospital. And one of the first people we saw, I don't know if he remembers this, but on the floor, we walk in and there's a 20-something-year-old male who had been injured. He had been struck. We're not sure. Maybe it was an airstrike. Maybe it was a tank shell. Maybe it was some bomb. We didn't know exactly what it was, but we came right in the middle of it. We saw what was going on. And so we tried to help. We tried to do what we can. The doctors that were there were also working on this patient. And after about 5 minutes or so, he died. And I remember the first thing that the doctor, who's younger than me, he's probably in his 20s, he got up, he looked at the family, because the family is in the room, in the emergency department, watching you as you're trying to save the loved one. It's not like here in the States where they ask you to stay in a quiet room or they put you in the waiting room. They're there with you, so they see everything that's happening. He stood up, he looked at the family, and he said, his last words were, Ashhadu an la ilaha illallah, ashhadu anna Muhammadan Rasulullah. And right away, we knew the situation that we were in. Right away, we felt just how serious things were. This person was on the floor. There was no bed for them in the hospital. And the family looked at the doctor and said, that was his last words? And he said, yo, those were his last words. They said, Allah yarhamu, and then they went about their day, having to pick up their son, themselves, the family, put a blanket around him, and take him to bury him in the cemetery. So this was the very first hour that we were there. And what we saw over the course of about 3 weeks was nonstop people coming in, families coming in. And it was something that was very, very overwhelming for us. Something that for me, I knew what was happening. I was not prepared to see the suffering that was taking place and how nobody was spared from the suffering. Did not matter. Man, woman, child. Did not matter what was happening or what was going on, day or night. It was nonstop. It was all the time. I want to mention just a few stories about the people that I interacted with to give you an idea of who the people in Gaza are and what they have to deal with. The day that we were also upstairs in the ICU, there had been a patient there, and his nickname was Saruch. His nickname was Rocket. So why is his nickname that? Because he used to have a donkey, and he would pull the donkey, the cart that he had, the donkey would pull, and he would go to areas that had been hit by rockets, that had been hit by bombs and strikes, and he would put the people on the cart that were injured or who had been killed, and he would take them back to the hospital so they can get treatment, or he would take them to the cemetery so their family could bury them. He's a young guy in his 20s. So he was hit by an airstrike doing this, trying to take people to the hospital. He had been in the ICU for about 10 days. He was very sick. He was very, very sick. And his family would come and visit him every day. You could visit from 12 p.m. to 12:30 and from 4 p.m. to 4:30. One of the days, overnight, he also died. Allah yarhamu. And so his dad came the next day, and he had no idea that his son had died. He looked at the room. His son wasn't in the room. He said, "What happened to my son?" They said, "Inna lillahi wa inna ilayhi raji'un." He had passed away. He said, "Why, you guys can't call me? You couldn't tell me what was going on?" Hajj, Ammi, there's no ittisalat, there's no service. There's no phones. We can't get a hold of you. I'm sleeping in the hospital. And it was not about what we said or what we did, and it's not about what had happened, but it was just that I felt in that moment that every aspect of life in Gaza was under attack. It's not just about the bombs. You can't even call your family members. We know people in Gaza, they've been displaced 4, 5, 6 times. All of them are split up. Some of them are staying in the European hospital. Some of them are staying in Rafah. Some of them are staying in a different part of Khan Yunis. So how can they communicate with each other? Moms and dads and children, they can't even communicate with each other. Are you okay? Last night was intense. Is everything okay? I couldn't communicate with my family for 8 days, and my family's not in Gaza. They're not under attack. How about these people here? In Khan Yunis, in Dir al-Balah, in Rafah, in Medinat Gaza. They're all scattered and separated, and they can't figure out what's going on with each other. Internet is off, so you don't know what's safe, what's not safe. Water is cut off. So you have to wait for a truck to drive by and hope that you can get in line and you can fill up your container from a hose before it runs out of water. Food is clearly in shortage, clearly in short supply. People there have gone months without having meat. They said they had not had chicken since the war started. Every day it's trying to figure out where you can get one meal from. And on top of that, amongst all of this, is just not knowing if tomorrow is going to be better than the day before. But what I saw is, instead of me being there and trying to show that, hey, we stand in solidarity and we help you, I saw that they were comforting me most of the time. They were saying, this is okay, this happens, we can deal with it, we can take care of it. They're offering me food from the one meal a day, they're offering me food. And they're saying, please, you eat first. You eat first. Make sure you eat till you're full, and then we'll eat. These are the nurses, the doctors, the patients, the families. They're checking on me when there was really intense bombing in the hospital at Nasser. They're knocking on my door. Doctor, is everything okay? Just that you know, everything is fine. Don't worry about it. And on top of all of this, they are sitting there and they're doing it in a way that makes you inspired and want to help even more. They're remembering Allah subhanahu wa ta'ala whenever they can. And then at the same time, they're keeping up this sort of dignity that they have when it's purposely being tried to strip away from them. Taking care of each other, making sure that everybody's doing well. I don't want to take too long. I brought some pictures that I want to go through, but I want to let some of the other doctors share their experience. And then hopefully I can kind of just show you what things look like on the ground.
Jazakallah khairan, Dr. Hussam, can you put the first video from ABC? This is an interview that I had right after I came.
And this is a patient on the floor.
Over the past 15 years, Dr. Zaher Sahlul.
The other one, Hussam.
The International Committee of the Red Cross reports Gaza is at risk of a complete medical shutdown if urgent action isn't taken to preserve services. I want to bring in Dr. Zaher Sahlul. He's the president and co-founder of Med Global, who has led a volunteer team of doctors on a medical mission in Gaza. Dr. Sahlul, thank you so much for being with us. You've worked, in hospitals in Gaza as well, the clinic in Rafah. What stood out to you during your time there?
Thank you for having me, Morgan. Sorry, I have a severe chest cold. But I have a lot to process in the last 2 weeks. We've been in this medical mission for since January 9th until January 25th. And what we have seen is complete destruction of the healthcare system, where you had large number of people. Most of them are displaced to a small area in Rafah who have no access to good healthcare. Most of the hospitals have closed in Gaza. That means the few remaining hospitals are the only way to get treatment for your medical conditions, for the injuries. I work in a hospital called Nasser Hospital, which is a large tertiary healthcare center in Khan Yunis. And by the time we ended our mission, the hospital was near completely surrounded by the troops. And many of the patients who were brought to the hospital had no surgeons to treat them. Every day there were mass casualty events to the hospital where you had numbers of civilians who are brought after a missile attack or bomb. Many of them are children. Some of them are dead. Some of them survive for the next day. And they undergo surgery, then they have complications because of the limited resources. In the clinic that I've treated patients in Rafah, we had a clinic that it was established by Med Global. We were seeing 700, 800 patients every day. Many of them have respiratory infection like what I have. Many of them have diarrhea because of the lack of clean water. And by the time we ended the mission, the hospital that I was talking about is near completely deserted because of the approaching fighting. And many of the hospitals in Khan Yunis also are right now inoperable. That means the few hospitals that were available when we started the mission are not available when we ended the mission.
Dr. Sahlul, you are describing such a toll there. How dire is the healthcare situation there in Gaza, and how are healthcare providers like you handling it?
It's. I don't have words to describe what I have seen. I've been in Ukraine, I've been in Syria, I've been in Yemen, in many other disaster areas. I've been in Gaza before multiple times, but this is the worst I have seen. And I think every doctor and every humanitarian should be talking about what's going on in Gaza, because we are depriving the population of Gaza, the 2.2 million, of access to healthcare. We're not talking only about the injured who have now no surgeons to treat them, no operating room to treat them, and no medical supplies. Simple things like fractures needs plates and screws, and there's no plates and screws in the market or in the hospitals because of the shortage of that. IV antibiotics are not available. Insulin is not available. Patients with chronic diseases don't have access to blood pressure medications, to seizure medications. Patients with cancer don't have access to chemotherapy. It's something that is probably from a horror movie. And there should be a way to ease the humanitarian situation. All the talk about increasing humanitarian aid is not translated into action. What we need in Gaza is not only the 100 trucks that are entering. We need 1,000 trucks of medical supplies, of food, of clean water, of fuel to enter every day. We need to stop the attacks on healthcare, and we need to stop, of course, the war, because it's causing huge harm on innocent civilians, children, women, the elderly, patients with chronic diseases.
Thank you so much, Med Global President and co-founder, Dr. Zaher Sahlul. Thank you so much for the work that you're doing.
So I would say a few points. And sorry for my voice. I still have this chest infection, which I got from. So probably it's a blessing to have this chest infection. Would like to have a memory from Gaza. Please come towards me so I can hug you after this. By the way, I started my activism and humanitarian pathway, and I see a lot of young people here in the masjid, in this spot, in the Mosque Foundation. So this is part of me, part of my life, part of my family life. My wife grew here in the Mosque Foundation. Without my work and service in the Mosque Foundation, I would not have been in Gaza. So all credit goes to this masjid and the blessing that comes from this masjid. And I think Thaer also agrees about me. He grew also in this community. And I remember in 2008, when the first war broke in Gaza, one of and maybe Fauzi knows, we had a demonstration, big demonstrations in downtown. At that time, President Obama was starting his first term, and he said terrible things about what's happening in Gaza. And our community went and contested what happened there. And I think many of you remember that. And that was our also first activism about what's going on in Gaza and in Palestine as a community. And we were united. And at that time, we decided, I think, as a community, especially after 9/11, that the best way to deal with the situation over there is to be active here. So it is important for us to understand that these issues, these policy failures that our government have been going through in the Middle East and in Palestine, the best treatment for them is to be civically engaged, to be civically engaged, to run for election, to have representative in the state, to have congressmen who represent our community, who can we can be accountable, they can be accountable to us. Right now, the representative from this community is not accountable to us. And we had a recent meeting with Congressman Gaston, and he was very cold. Sometimes politicians can just project empathy and they tell you something that to appease you, but he did not even try to do that. So I think it's very important for our community to be more active and to make sure that the representatives that represent this community should be accountable to us in this issue and many other issues. When we first entered Gaza, you feel the difference between Egypt and Rafah. Rafah is a city south of Gaza, had a population of 300,000 people before the war, and now has a population of 1.5 million people. So imagine the stress on the city. The first thing that attracted my attention is the tents everywhere. And I'm not talking about tents that are proper tents, the one that you see on the movies or provided by the United Nations. These are tents with plastic bags because there's not enough tents in Rafah. And you see people everywhere and you see the desperation. So you feel the war when you first enter Rafah. We went to our guest house, which we stayed there with our team in Gaza. We have a team of 4 humanitarians who've been working tirelessly since the beginning of the war, distributing medical supplies in hospitals, and then they were displaced with their families. Some of them lost family members, and we stayed with them in the house. We went to sleep. After 1 hour, we woke up with the house shaking, and there was a huge explosion near the area that we were sleeping in. And we went downstairs to see what we were going to do, but then after that, we went to sleep. And then every night, every few minutes, every few hours, you will have explosions. We live the war. The war is very close to you in Rafah. You see the fighter jets, you see the missiles, you see the bombs, you see the artillery, you hear the artillery, you feel the house shaking. So imagine yourself in Khan Yunis. Imagine yourself in an area that is attacked by the IDF. So the war is very present and you feel it and you feel every part of it. And then you see the impact of the war. You see the impact of a missile attack when you are in Khan Yunis hospital with a mass casualty event. Mass casualty events means that you have more than 5 or 6 people who are injured from the missile and the bomb flooding the emergency room. And you have very limited resources to deal with that mass casualty. Here at Christ Hospital, everyone in the hospital respond to mass casualty, and everyone will come to help, including the vascular surgeon, the orthopedic surgeon, the trauma surgeon, the neurosurgeon. You do CT scans, you do MRIs for every patient because you want to save their lives. In Gaza, you cannot do that. You cannot do that. So people actually, because you cannot have time to spend with them, or because you don't have vascular surgeon who can repair their vascular injury, or because you don't have plates and screws so you can fix their fractures. I'm just gonna mention one story, because it's representative of the stories that you hear about and you see in media. And our media here and the President Biden, questioned the number of children that were killed in Gaza. I think this is something that we have to remember as a community, that our president even did not have the empathy to sympathize with the people who are children who are being killed in Gaza. And he said he questions the number of 7,000 at that time. I can assure you that the number of children who are being killed, more than the 10,000 that are reported, because many children who are still under the rubble. So one of these children, his name is Muhammad Khalil Abu Shahla. And I know the name because I saw him in the emergency room after one of the Khan Yunis. And he came in with 32 other injured people. And he was on the floor of the emergency room because we did not have enough beds in Khan Yunis. Dr. Thair Ahmad was treating him. And this child had part of his brain out, which is a huge injury. And you know that when you have someone like this, that they're not going to make it most likely, no matter what you do. He had also abdominal injury because of shrapnels. When a bomb fall, you will have a lot of shrapnels that penetrates the bodies of people around the area, including children, especially children, because they have soft bodies, they don't have enough muscle mass. So many of them will have severe injuries, and that's why people who are injured. So he came in, he was intubated by Dr. Thair. He went to the operating room, and the surgeons did abdominal surgery. They repaired some bleeding, and they sent him to the intensive care unit. I came next morning, and I took care of him, and he was brain dead. He never woke up. And his family were not informed because there is no way to communicate with his family. So they pronounced him dead, and they sent him to the morgue. This is one out of the 10,000 or more of children who are being killed in Gaza. Sometimes we get fixated on the numbers, but every life is precious. Every life is precious. And I think it's important for us to know the names, and to say the names, and to say the age, and to say that this child is from Bani Suhaila, and he was displaced with his family to Khan Yunis because of the fighting. And then he was killed because that there was not enough resources, that our government is bragging that they are sending enough supplies. And we have to demand from our congressmen and our senators and our State Department, our president, that at least send enough medical supplies so people who are injured can be treated. And this is not something big that we're asking for. We're not even asking for the end of the war. But the war, of course, should be ended. But at least let them eat, let them drink clean water, let them have medical supplies, let them have insulin for the people who have diabetes, so that way people who are innocent, who had nothing to do with this war, can survive. Jazakumullah khair.
Assalamu alaikum. And I was wearing mask for 3 weeks in Gaza. I was good until we crossed into Rafah, and then there was a person coughing behind me in the 10-hour van drive. So as soon as I come, I texted him the next day. I woke up with the same symptoms. What antibiotics are you taking? Now I'm on second course. I'm just follow whatever he's taking. And once you enter Rafah, it was nighttime, and the first feeling that crosses your mind, there was no electricity there. So the Al-Mawasi Desert, it splits into both Rafah and Khan Yunis. And you see from your van headlights, people are walking. People are everywhere. Children, men, women, disabled, in wheelchair, in donkey carts, hospital carts, whatnot. So it's cold. It's cold inside the van with that all the air condition. So these people are walking in pitch black dark, no food, no water. They don't know where they're going, and they're just arriving there. It's not like we're going on a trip to just go for a, camping. And as you mentioned, Rafah could be like 5 miles from Khan Yunis, and it's still the first night, the impact of the blast waves from the bombing, fighter jet bombings, that shakes the window of your guest house, and then constant firing and stuff. And then the next day morning, we split into 2 teams. Myself and Taher, we ended up in Khan Yunis in Nasser Hospital. I have audio recording if you want to hear what it is like to be there. Can you hear me? So this starts around every day between 3 in the morning to 4:30, and it continues until midnight. So this is the noise every child, man, woman, living in communes, they live with this noise. And there is 24/7, there is drone noise on the circling above you. And the only time they go away is when they call in the airstrikes, when the fighter jets come in. And then you hear a whistling noise and boom noise, followed by within half an hour or so, they bring a lot of patients. We call them DOA, dead on arrival. You might have seen this Soul of My Soul. So a lot of these young, beautiful children, they look like they're sleeping and only covered with the dust of the concrete. You feel like if you clean them up, you can ask them to wake up and go to school. They look so beautiful, not even a scratch. The blast waves kills them. It ruptures the lungs, they die instantly. Later on, they bring some patients like crushed injury and so on. There's a clear pattern. If there is shelling from the tanks, that's most horrific injuries. You can see people without arms and legs and whatnot. And there are sniper shots. They purposefully shoot not to kill. They want to make your living more painful than being dead. For example, a shot could go through your jaw on one side and comes out the other side. And they shoot all parts of the body to keep you alive, but miserable for the rest of your life. And as a surgeon, what I found most difficult is they fire these pellet fill, you know, the metal balls, like 2-3 millimeter round pellets. Thousands of those pellets fill missiles. They fire from the drones. So when talking to the surgeons, they say sometimes they fire one missile in a densely populated area. We ended up operating on 36 patients. 36 patients from one missile. And imagine it's like somebody has had cigarette burn all over the body, 10, 12, 2 dozen. And we don't know how deep they are. Sometimes they're superficial. Sometimes they go through everything. I remember with Dr. Teher here, we had a young kid, maybe 15, 16. He came with his eyes pouring out of his one of his eyes. When you clean it, some blood comes through. So we had to intubate him. We put some chest drains on both sides, collapsed lungs on both sides, send him for CAT scan. And he came back from CAT scan and he died. The CAT scan, after he died, we looked at the CAT scan. He had a lot of metal fragments inside his brain tissue that went through his eyes. So some patients, other patient I could recollect, this patient came in the middle of the night. They thought it's superficial wound, it's not deep. They sent him home. 2 days later, he came in with a hemorrhagic shock, a septic shock. And before we could take him to the operating room, it's a young person, maybe in his mid-20s. He had a cardiac arrest, and Tahir was doing the ultrasound to look for cardiac function. We take turns in doing the CPR. Being a young person with no other medical problem, we tried our best for 40 minutes, but he couldn't make it. So that's the kind of lethality you see from these fragments. They go as deep and far inside. Doesn't look dangerous in the beginning, but they could kill you. Even when you operate on these patients, when you go and you look for it, it's so difficult to trace dozens of these tiny little things. You miss one, patients come back with a leak 2 days, 3 days later. And because of the sheer volume of surgeries you do, sometimes they do 12 emergency surgeries by noon. There's not enough supplies, not enough antibiotics, not enough medications for anesthesia. The wounds are horrible. And for 27,000 patients who's died. There are 70, 80,000 who are wounded. Most of them are children. Many of them live with an open belly. So crush injuries. This is very inhumane. And other couple of things they worry the most is the quadcopters. They put these AR-15s in these drones. They come through the windows and they fire everybody indiscriminately. That kind of stuff. And so what's going on is shame on humanity, shame on people who claim to be civilized, but still being complicit in these kind of atrocities. And when you can think, what else can they do worse than this? They go ahead one more step and they cut off all the funding for UNRWA. They supply the basic drinks and water and medicine and prenatal vitamins, nappies. They want to cut down everything, so inhumane. And short, this conflict, they have perfected the art of cruelty. There is merciless brutality, no matter what, whatever your political belief, religion, nationality, location. No one deserves this, ever, ever. Thank you.
Assalamu alaikum. I'm a pediatrician, and the horror that my colleagues have just described is beyond belief. I'd like to take for just 1 second to try to put you into a context of what's happened daily. There are probably, I don't know, 200 people in the room now, maybe 250. There's 700 people we see at the clinic, and our clinic is probably, it's not the size of this room. And those 700 people mass up from 7:30 to 10 to register. So picture 700 people, picture all of you coming to this desk for 2 people to register you. That's what happens at the beginning. We see in pediatrics, we saw in pediatrics probably, I don't know, 100 to 200 patients. Of those 100, of those at least 80% were under 1 year of age. Under 1 year of age. And of those, the majority were under 6 months of age. And I'll give you a picture. All of you who have children here can say, you come in to see me, your baby's got a diaper rash. I look at the diaper rash and I say, well, it's kind of a bad diaper rash. Here's a prescription for a cream. Now, all you really have to do, you know, your grandmother told you this, all you really have to do is just go on home, leave the diaper off, change it frequently, clean the little buttocks, put the cream on it, leave it exposed to the air, and it'll be fine in a couple of days. Don't worry about it. Well, that's all real nice, except it's 50 degrees. There's no heat. There's no clean water. There's no clean Pampers. There's no cream. There's literally nothing. This is an attack on integrity. This is an attack on agency. I'll give you one statistic. It's not really a statistic. I'll give you anecdotal, an anecdote right now. There is an increase, as we were leaving, it was reported that there's an increase in post-mortem C-sections. That means sections after they die. Now I'll ask my colleague, how many post-mortem C-sections happened in Chicago? When I trained, 0. Now there's more because of the increase in gun violence, but there were at least 5 on the day before we left. And this was told to us by the United Nations. So this is the level of insult. The working in tomorrow, we can get 1,000 or 1,500 trucks in to rebuild every hospital known. But guess what? Any education that our children have had there they're in the, say they're in a 4-year program, a 3-year program, any nurses here, any doctors here, any lawyers, every one of those have just been stopped, hard stopped, not coming back. So the working in tomorrow and that generation of professionals for Gaza is done unless we can figure out a way to complete their education. My colleagues will tell you that some of the trainees that were at the hospital with them would just soak up any amount of education, any amount of teaching they give them. But that's not a complete education. That's not a certificate. That's the level of attack on integrity, on our culture, that's happening right now. So I'll leave it go now because I'm sure there's questions from the audience and more questions will be on. So thank you very much.
I do want to put a couple things into context for everybody who is not familiar with Gaza Strip. It's about 26 miles from top to bottom, and at its widest, it's 5 miles. So when you think of it in perspective of Chicago, it's a little bit smaller than the Chicago and Chicagoland area. And it carries far more of the population. So our entire Chicagoland area, including the suburbs, makes up about 2.9 million. But now shrink that into the context of the Chicago city, and that's about 2.2, 2.3 of Gaza's population in such a very densely populated area. Now, to compare, Chicago has 105 hospitals, clinics, healthcare centers that people can go and seek care, whether that's prenatal care, emergency, urgent care. Gaza had 36. By Thanksgiving, 22 of those were completely non-functional. So only a third of them were still standing. Obviously, not all of them were operating at 100% functionality. So these clinics that were still up, these hospitals were partially functioning. Some were able to work with the limited resources they had. Some only had one wing available or one floor available, and the rest was completely shelled out. By January 1st, Gaza's only pediatric cancer center, adult psychiatry center, and adult palliative care center were completely destroyed. Now, this is, like all of the doctors have alluded to before, an attack on not only life, but dignity and death, and for the future downstream effects. There are reports from the United Nations and the World Health Organization that we're seeing increases in outbreaks of things like hepatitis, skin infections like lice and impetigo, and then upper respiratory infections like pneumonia, because people are living in such small quarters. So now if we're looking to things like our old schools or grade schools, you have anywhere from 30 to 60 people living in one classroom as their home. That is all they have at this moment. Now, I mentioned earlier my family is from Gaza, and there's one thing in particular that I do want to, one story that I want to mention just to put things in perspective. A lot of the women and anybody who has children will understand this, but given how limited the resources in Gaza are, if you have a vaginal delivery, like a natural delivery, or if you have a C-section after you've given birth, you're asked to leave the hospital on the same day. For people who have a natural birth, that might be a little bit easier, but it's a lot of strain on your body. But for months on end, it was very difficult to access anesthesia to have a C-section. And some of the doctors in Gaza reported that they actually had to do C-sections without anesthesia. So without any pain medication, not even Tylenol was available to these people, and they had to do anesthesia. And they had to do the C-section without anesthesia. Now fast forward, they were asked to leave on the same day that they had that surgery. So a C-section, for those who are not familiar, is about 15 centimeters wide, so 6 inches long, and it goes down through 7 layers of skin and then into your uterus, where your uterus is literally torn to shreds to pull out a baby. And now imagine all of that being stitched up with no anesthesia and being asked to leave home in the same exact day, hours later. This is not a one-off thing. This is very much a regular occurrence, unfortunately. And people who are leaving, my own family members will say, en route, they faint from the pain, from the blood loss. It's a very difficult situation, and it's very dire. And a few people have also alluded that our one role and responsibility here as people living in America is one to advocate, to call our Congress people, push for a ceasefire, push for the aid, and then donate in situations where our money can get aid in. So that being said, there are a couple of questions that we have already from some people, and then if we have enough time, inshallah, at the end, we can take questions. But what would you say in this trip, for those who've already been to Gaza and who've done a medical mission there, what surprised you the most this time around compared to things like 2008, 2012, 18, and 19?
I can start. This would be my 5th visit to Gaza. I think there is no comparison to the previous trips. I had gone after a couple of the wars Operation Cast led. I went twice afterwards, and I remember there was, at that time, there's destruction and devastation. This, to me, is one of the most surreal things I had ever seen. I mean, it just felt like a World War II movie. Anywhere you look around, especially as we were going to Deir al-Balah or in Khan Yunis, you see just rubble. You see tons of people crowded trying into these tents. I think just the fact that it seemed like there was no part of life that was left untouched was so overwhelming. Across from Al-Nasser Hospital, there was a school, and you see it's packed with people. You walk downstairs in Nasser Hospital, you go through the emergency department, you see mattresses and blankets everywhere. People are sheltering in the hospital. You are walking outside and you see all of these different tents. Nobody has electricity. Nobody's able to charge their phone. Nobody has enough to be able to have breakfast, lunch, and dinner. They're looking around to see if there's water. In the hospital, a kid trying to fill up his water bottle, and it was around the end of the night. And he turned on the faucet and only drips are coming out because the water in the hospital for that day was done. They needed to refill the tank on the top. And this was 7 or 8 p.m. A hospital ran out of water. So we couldn't clean our hands after we were seeing patients. They couldn't fill up water for their water bottles. It was so overwhelming. And every day it became more overwhelming for myself compared to the previous trips. I mean, before October 7th, Gaza had its own challenges. And I'm going to just mention what a nurse told me, an ICU nurse. He said, and he took this in a spiritual way. He said, Subhanallah, إحنا كنا عايشين بألف نعمة. We were living with 1,000 blessings before October 7th. He said, we would complain because we were only getting 60% of our salary. Every month, they couldn't get 100% of their salary. They can only get 60% they were being paid. Said we would complain about not being able to leave outside of Gaza because nobody was really allowed to leave. It was very hard to get out of Gaza. He said we would complain about electricity being cut off for 12 hours because on average, Gaza would have 12 hours of power and 12 hours without. It's called the energy deficit. He said October 7th came, the war started, and he goes, now we had 0% of our salary. We had 0 hours of electricity. We can't even leave certain streets, let alone our cities. He's like, Allah subhanahu wa ta'ala was teaching us that you were living in a lot of blessings and you were having so much. And I think it captured for me, number one, just how different this time around was and how everything was trying to be taken away. It did not matter if you were a business owner, if you were a doctor, a nurse, an engineer, an architect, if you were somebody who was a farmer. Every single person was struggling. Every single person was attacked. Every single person was not. And so I think for me, that's the thing that probably stuck out the most.
I think the thing that was the most, that really stood out to me was that in 2018, 2019, when we were there, we were invited over to families' houses every night to eat, and I mean eat. It was just a wonderful cuisine. It was just wonderful. It was just absolutely wonderful. This time, there would be a line. You might have seen the headlines that bakery reopens after 50 days being closed or something like that in Rafah. I saw it before I left. I didn't notice it until we were going to the clinic in the morning. There was a line of at least 500 people waiting to get bread. So any nutrition, nutrition is a strange word to use in this. Any calories they got were simply carbohydrates, and they would wait hours on end to get this. So the most popular place Zahir told me every time we went by, he said the most popular place in Rafah right now is any 2 bakeries that are open. And it was that. It was true. I mean, and people were late. But the thing that amazed me wasn't the lines. The thing that amazed me was the civil order. I could imagine what those lines would be around. I mean, what the order would look like around here. You know, you see when tickets go up for sale for Taylor Swift, people are fighting for them. This was 500 people waiting to get 2 loaves of bread, and it was as calm as this room is right here. And that really, really stood out to me.
That was my first trip to Gaza, but I've been to Syria and multiple times to Ukraine. One thing that struck me when you enter, especially in Ukraine, April 22nd, you can see rows and rows of buses coming out with women and children. So any conflict zone, they let the women and children go, elderly and disabled people to leave. In Gaza, nobody is allowed to leave. So they're bombing people. They're pushing them to the Philadelphia line. That's the border between Egypt and Rafah. 1.8 million people are there in a 60 square kilometer. So Rafah is smaller than several airports in the world. So they have been all locked into few terminals there. They ask you to go from terminal to terminal and they bomb you one gate to another gate. People not being let go during an active war, that struck me. That's one thing. And other thing is, as John mentioned, very dignified people, very resilient people. And when I come out, I feel like, at any moment I have some weakness in my life, I want to be Gaza strong. These people are still laughing. They have a great sense of humor. The Arab hospitality is amazing. They give you whatever little they have. So to understand what they have, imagine when you go home, just think there's no home for you there. Then you have children with you. What would you take in your car? You are just going somewhere in a desert. You don't have a tent. You don't have nothing to cook. There's no documents, nothing. Not even water to wash your hands. No privacy for, young women and men. There's no drinking water, no medicine. They even banned insulin. There are type 1 diabetics, more than 900 children with type 1 diabetes. They need insulin every day. Last week, they banned import of insulin. A lot of these injured children and men and women, they have to live with those fractures because there's no plates and screws to fix it. If you have a spine fracture, you're likely you become paralyzed than getting it fixed because that's not allowed into Gaza. So this is not by accident, this is by design. But still the people so dignified, there's no gangs running around, no violence, no riots. We walk in the middle of the night, they know we are American citizens, we carry phones, dollars, nobody bugs you. The children come and give you a high five, they talk to you. The humanity is still real there. So we need to help them back.
We have time for a few questions from the audience. I only ask is that you keep your question to truly a question and not a comment, and that it's just 30 seconds long when you ask so we make time for everybody. So if you have any questions, feel free to stand up on this end of things, on the men's side, and just speak loudly, and for the women, I'll bring you a microphone.
Better than we would what works, what doesn't, what is necessary, what's needed. So we would appreciate telling us what we can do to help.
Great question. First of all, I think what you have been doing is amazing. And I haven't seen our community that engaged in a crisis like this. Never in my life. And I think that speaks volume for a lot of years of preparation. Our community responded to this crisis and responded very well. You may not see the fruit of your activism now, but you're going to see it in the future for sure. So, of course, there are many organizations that are working in Gaza. One of my friends asked me, do things get into Gaza? Like if you donated, would that go to Gaza? Of course. We took with us about 15 luggage of medical supplies ourselves, but also we sent trucks of medical supplies before we arrived, and we have few trucks waiting to get into Gaza. So things are getting into Gaza, maybe not as fast as we would like it to be, maybe not everything that we would like it to be, but things are getting into Gaza. So supporting organizations that are working in Gaza is very important. Food, shelter, healthcare are very important. The second thing is advocacy, as I say, right, John? Advocacy is very important, and I see a lot of people organizing on WhatsApp and forming PACs and contacting your congressmen and senators. All of these are important. Sometimes you underestimate what you do when you send an email or when you call your congressman. These things will add up, and at one point it will change mindsets. The city of Chicago was the first major city in the United States that passed a resolution for ceasefire. Right? That's because of your activism. Chicago Sun-Times was the first major newspaper that asked for ceasefire. That's because of your activism. Your two senators, at least one of them, was the first senator who called for sustained ceasefire, Senator Durbin. That's because of your activism, not only now, but because of previous activism. So things are happening slowly. I think there is a momentum that at one point will be translated into sustained ceasefire. So keep doing what you're doing and keep people in your prayer. And people actually, I mean, the only thing that I would like to mention, Dina, about the surprise that I have, that people, as everyone else, are very dignified despite of the war, and honorable despite of the war, and generous despite of the suffering. So this speaks for the civic peace that we have in Palestine. And I think this community in Gaza will have a huge future because everyone is educated. I have a habit of asking children when I go to war zones, what would you like to be in the future? 9 out of 10 in Gaza, they will tell you a doctor. Okay. They're not going to tell you that I'm going to die. They will tell you I'm going to be a doctor, except for one child. I saw him in one of the schools. He was displayed with his family. I asked him, what would you like to be in the future? He said, what future? So
Just to echo one sentiment from Dr. Sahlul, if you are planning on donating, please make sure that you are donating to registered 501(c) organizations that are known to be non-for-profit. There's unfortunately a lot of scams that have been going on with people who are not from Gaza, but who are trying to profit off of the crisis in Gaza. So please, please, please make sure that whatever organization you're donating to is reputable. To name a few, Med Global is one of them, PAMA, the Palestinian American Medical Association, American Muslims for Palestine. I will always make that plug for them. UNRWA is now accepting donations from civilians across the world. So make sure that what you're donating is to something that is actually a known, reputable organization and not an individual who is telling you that they're taking the money into Gaza. Because from experience, it is quite impossible at this moment in time to get money into Gaza Strip. So known registered organizations for donations. Somebody messaged me to ask, specifically for you, Dr. Kaler, for pediatric patients. We've seen a lot of videos on the internet or on TikTok of children being completely still or sort of shaking and shivering in complete shock. Is this a trauma response? Is this cardiac arrest? How is this?
This is a trauma response, and it is, this is the one situation I've been in that I think literally 100% of the population has been affected. The children, I tell you numerous stories of classic anxiety issues with going back and sleeping with families, crying out, we're crying, we're clinging, things like that. But so I do think it's a classic post-traumatic response. It will be generational, and it can even be epigenetic. So there are many studies showing there's 2 or 3 generations on the line still showing these type of things with this type of trauma, and that is the type of trauma, and it is the goal of what's happening right now.
Another question that was, I like this, the women are texting it to me. This is very efficient. Somebody asked, how difficult was it for you all to get in? So did you guys get in through Rafah, Ma'bar Rafah, or did you go in through, I presume not the north, because that wasn't where any of you mentioned you guys were.
it's a long trip. First of all, it took us 2 months to clear our name. And we went through a delegation of UN cars. And as an initiative of the World Health Organization. So the WHO, the World Health Organization, wanted actually NGOs to get into Gaza to maybe add a layer of protection to healthcare centers because of the frequent attacks on hospitals. So we were part of this convoy. We went to Cairo, and from Cairo we took the bus to Rafah, about 8 hours drive. It was a tiring trip. We stayed at the border crossing on the Egyptian side about 2 hours and a half. So they cleared our names, and then we entered Gaza, and the same way backward.
And it's not that difficult getting into Gaza. Getting out is more difficult. The moment you go in and within a few hours you change your mind, they need a 1 week time for you to get out. So they need to arrange logistics, get the permission from IDF, Egyptian authorities. They put your name on the list that you want to arrange a convoy. So if you ever go there, please make sure you're sure, because getting out will take 1 week for them to arrange.
And for those who are not familiar, this is actually how the majority of people get into Gaza. They fly in to Cairo, they do the drive from Cairo to Ma'bar Rafah, then they enter Gaza that way. This is even pre-October 7th. This is just living in the siege in Gaza. Gaza does not have an airport anymore. There used to be a border on the northern part of Gaza Strip, but only people who did not have any Gaza or Palestinian citizenship or connections would be able to enter. So it's a very difficult life for people who are from Gaza or who are trying to enter Gaza in general.
Indeed, also one maybe comment on this. For people who want to go alone, they cannot do that because some people ask, okay, can I go to Gaza or to Rafah? First of all, you will not be allowed by the Egyptian authorities to even cross certain areas in Sinai Desert. You're not going to get to Al Arish if you want to go alone. So unless you are part of organization and you have a clearance of your names ahead of that, then don't even try it. And unfortunately, maybe Thaer was one of the few dual Palestinian citizens that were allowed to enter to Gaza. Lucky. And actually, we took a risk with him because he told us that he may be there. So we asked him one night before we entered that, there is a possibility that he's. And when we were trying to leave, they told us that his name is not on the list. But we took a chance, and alhamdulillah, I think his mom and wife were praying for him in the community. So he was cleared.
Yeah, not now. Inshallah, hopefully, maybe later. I was hoping, if it's okay, I'm sorry, I know we're taking a lot of time here, but I just wanted to show some pictures that we have from the ground, if Hussam can load it up for us. And in the meantime, so I just wanted to give you an idea of, this is out of the window that we were staying at in the Nasser Medical Complex. So you can see everybody gets as close to the hospital as possible. And that's where they're setting up their tents. And then you can see a destroyed ambulance there. You can go to the next slide. This is inside of the emergency department. You can see, if you're not in the healthcare field, I will just tell you, this is a very old and outdated ventilator. Not to say that he's old, just that he has experience, but Dr. Zahir knew how to function this. We were struggling with it, and he actually knew how to get it to work for us. This oxygen tank is broken. We don't know how much oxygen is left, so it's a risk using it. And then you can see there's so many people. There's not any beds. We had to work on the floor there. If you can go to the next slide. This is the room where we are called the resuscitation area, or Anayat al-Naash, and you can see it gets very, very, bloody quickly with how many people are coming. This child is, this is where his home is in the hospital. He's on the corner where you can see the hallway, and he was trying to take a nap. You can go to the next slide. This is in Khan Yunis. You can see from the different parts, the buildings are being detonated and exploding. So there's just total clearance of these areas. You can go to the next slide. This is also in the hospital. You can see they were able to get some flour and they were ready to bake for their family there. Outside where the people are gathering, there's a TV where they are all gathering, trying to figure out what the latest news is during the blackout. And then the bottom right picture is right in front of ICU where people would be sleeping. This is around 2 a.m. at night. You can go to the next slide. This is the Philadelphia corridor. Chandra was talking about. You can see the wall. There's 3 different walls separating Gaza from Egypt to make sure that nobody can get out. And then if you look the other way at the bottom, these are with the tents that are looking at that wall. Tents for people in Gaza. And then this child is being evacuated out. There are 6,000 people in Gaza waiting to leave. They need specialty care. They have medical doctors who have said they need to be transferred out. Around 10 a day get out of the 6,000. There was a famous video, if you remember, of a father ripping up taqreer that he said, his son had died. He's dead. Are you happy now? My son is dead. Are you happy? He's ripping up because he didn't get out in time. If you can go to the next slide. Some of you are familiar with the guy in the middle, Mu'taz. He's famous, but it was interesting because he doesn't realize how famous he is. One thing he says, like, yeah, I know there's 8 million followers on Instagram. I just know that that's more than Joe Biden. I don't, and we, one of the things that we would share with him and all of the people in Gaza is there's a lot of people who support you guys. There's a lot of people who are thinking about you. In this video, we showed him a protest from Chicago. We were showing the kids there, and they were shocked. They were shocked that the Palestinian flag was downtown Chicago being raised, and people were saying, "Free, free Palestine." And then this is the beach area where the rainbow is. This is in Rafah. You can see the tents. This is the main road, I think, Shari al-Rashid. And then that's a gas station there's no fuel inside of there. All of the fuel is being smuggled in, which becomes very expensive just to get from point A to point B. And then one more slide, I think. So this is all in Rafah. You can see these solar panels are set up on the street so people can come and charge their phones or charge whatever they have. You pay 1 shekel or 2 shekels, you can charge for 30 minutes. That is the line that Dr. John was talking about at the bottom right for a bakery waiting to get bread. And then you can see vendors are on the street. These are people who are taking the aid that they get from the musa'adat that they have, and they need something else. So what they'll try to do is try to sell some of the food that they have so that they can buy something else, like hygiene products. I think that's it, right? Is there another one? Oh, just another example of what it looks like on the street. So I just wanted to this last picture here is, even all of this, people are still trying to live. 120 days of war, rocket attacks. You see a bunch of kids going to the beach. You see people getting haircuts outside of the masjid. The masjid became also a barbershop. So every masjid we saw, somebody outside is getting a haircut there. And then these were some of the students that Dr. John was talking about. These are all residents, so they're in their training. And this is around 1 a.m. at night in that top right. And they're just asking questions. How do we do this in America? What do you do if this patient comes in? What kind of medicine do you have? So there's still people who are pushing through, and that was very inspiring. Right. What I will say is we found out very quickly that everything was inflated. The price of everything, the inflation was insane. Not that anybody was a smoker, but the example that they gave was a carton of cigarettes was 20 shekels. Now it's 80 shekels, 4 times the price. Coke, which were some people don't drink Coke, but a can of Coke is 2 shekels. The time when we were there, it was 10 shekels. Everything of life was more expensive. Diapers were expensive through the roof. Gas was $100 in terms of how much it cost. So life had become prohibitively expensive.
Just to add to that, diapers are completely inaccessible now in Gaza, and women hygiene products are nowhere to be seen across the entire region. So it's a very difficult lifestyle, aside from, even if you did have the money to be able to find it, those items aren't even available. We can take a few more questions.
If you want to be smuggled out of Gaza, the price before the war was $4,000, and now it's $12,000. Expensive.
Yeah, we had one case in the ICU. This child was very sick, and the rest of his family had been killed. And I had asked what was going to happen when he was going to be discharged from the ICU. He's still very sick, and they said the doctors there said that they would find someone, a distant relative or a good family friend, and that they would, take the child in. They said that was commonplace, at least in Gaza, for anybody that lost a lot of family members. They would work on finding someone close to the family, someone who the family was very close with, and that it's not like they would have to, how do I say this? This was something that the entire community was prepared to do. Everybody in Gaza was ready to take in someone who needed to be taken in, regardless of what their situation was. And so there are over 25,000 kids who have lost at least one parent in Gaza, and that number continues to climb. And so I think that is there's a big challenge there, of course, but it's something that the community is ready to take on.
The dental care is one of the huge shortages for everything, fillings, extractions. Many people have dental problems, but because there's no dentist and there's no supplies, they live with pain and they just take painkillers for their, simple things. So there's a need for dental mission at one point. We're trying to explore that possibility, but this is a huge shortage.
Just a minor correction. There are dentists. There's just no supplies of activity. I mean, actually, one of my young woman that translated for me was a dentist, but there is no care.
And then the final question that was just sent to me for whomever would like to answer. Now that what you saw in Gaza, now that you're coming back to your jobs back here as physicians in America, are you viewing your scope of practice differently, patients differently? What is the sort of change in your practice now that you've seen what you saw in Gaza, now that you've come back to the United States? How has that changed your medical practice here?
I mean, first of all, how would that change my life? I think all of us feel that this mission is transforming experience because what we have witnessed is something that is probably historic. I mean, we all generation lived with the pictures of the Nakba in 1948, where you see black and white pictures of a Nakba. Now we're seeing it in color. Actually, I took videos of one of the displacement of people from Khan Yunis to Rafah after one of the bombing. And I was showing it to John and to Thair and Chandra, and telling them exactly this picture. If I put it in black and white, you would say this is 1948. You see people carrying stuff on their backs or donkeys and cluttering the street. It took us about 3 hours to get to our home, usually in a trip of 30 minutes. So I think it changed our lives. We are human, so it takes for us to get over this trauma. I think all of us are affected. My wife knows that more than anything because my sleep is not normal. It gets maybe a few weeks to get normalized, and it's tough mission. How does it change our practice? First of all, we're seeing what social media. So nurses and doctors at Christ Hospital were watching, were reading, and I was amazed that every nurse, every doctor in Christ, they're telling me we were reading the post on social media and we're proud of you. So it's changing people around you, even if you don't think that they are changing. They're reading. I'm not talking about people who are from the Palestinian or Muslim community. Every other nurse and every other doctor that they were watching what we are doing, and they're impressed and they are engaged in this situation. It gives you different perspective about life and death, and then the meaning of life, and the abundance of supply that we have here in this country, that we spend millions of dollars to save one lives. But some people, like in Gaza right now, they die because there is no insulin, for example. So dealing with limited resources, and how can you ration in the United States, because there's no unlimited supplies even in the United States.
I'll say one thing and then I'll pass it to John. But I remember that there was one night in Nasser Hospital, Khan Yunis, and I will say this, and I'm not joking, but somehow Dr. Chandra was able to fall fast asleep while these bombs were going off every 5 minutes. And I remember we had moved to the floor because the windows were shaking, and we thought the windows are gonna break, the shrapnel's gonna fly through. We could hear the tanks, and so we were putting mattresses up on the windows. And I remember thinking a couple of things. I thought, this might be the moment where I may die. Number one, I said, I don't know if my mom is ever gonna forgive me because I lied to her about going to Khan Yunis. I told her we were gonna stay in Rafah, but we ended up going to Khan Yunis. And then I was thinking of, if I make it out of here and I make it back home, I wonder how that's going to play a role for the rest of my life. And then I got back, and same experience that Dr. Zahid just mentioned. This is why I wanted to bring it up, is so many people who are not connected to Gaza at all. We're just saying, wow, we're so proud of you guys for going. That was amazing. That was amazing. And this is what I thought. And this is what I've told them. I said, my parents, my father, Allah yarhamah, my mother, raised me to care about this place and taught me that Allah subhanahu wa ta'ala said, you got lucky, you got this privilege to be here in America, and you could easily be just another Palestinian person who's over there. So take advantage of the opportunity here and do what you can to help the people there because they deserve it. And I think anybody in this room given an opportunity to put something for Gaza, whether it's in any profession, that they would do it in a heartbeat. That there is nothing special about, something that I did or, thank you. Yeah. So I know that, and I know that listening to khutbas from Sheikh Jamal for several years, just always talking about, what's correct, al-haq, and all of the different things that are involved, that influenced me. But I want to say that this new generation right now that has somehow taken upon this cause and said, yeah, we're not going to let this happen. We're not going to accept what's happening to Gaza. The whole world may accept it, but we're not going to allow it to happen. I think that's what's changed me as well. Just being inspired by people who are willing to go every Saturday downtown, regardless of what the weather is, to stand in front of Blinken's house, to stand in front of all of these different people who are involved, to stand in front of their houses and say, we're not going to sit idly by. I feel that now every single thing that I think about, I want to see, is there something that I could do to help Gaza? And it's because of all of the people around me, the people who helped raise me, but also the people who are younger than me that are sacrificing so much to speak out on this. So it works. It's affecting people, even though the people on the very, very top, it may not sound like that. Things are changing, and I feel it, and I see it from people who probably 2 years ago would have no idea where Gaza is on the map. So I just wanted to mention that.
Yeah, unfortunately, I can't change my practice much. I do a living doing surgeries for people to lose weight. So, but a thought did cross my mind. After war, I thought I should have a weight loss clinic in Gaza and take patients with me for a couple of months each. Because our breakfast was like we had a kettle. So we make tea with a spoon of honey and we had some dates. So that's for lunch. And the World Central Kitchen supplied some food for us. They were very generous. With 3 of us, they used to bring 3 packs of food, some rice and some meat. And we used to send back 2 and we used to share between us. Other important thing I want to convey is the empathy fatigue is real. This war is going on for beyond 3 months. It's very natural, human for us to get fatigue, and the media has moved on. If you watch mainstream media, it doesn't look like any war is going on anywhere. And we're still in touch with people who are in Nasser Hospital. We were evacuated when the tanks were a couple of blocks away from us. And the leadership decided, rightfully so, just get out. And then we ended up going to Central Gaza, worked in Al-Aqsa Hospital. But there are doctors, nurses in Nasser Hospital as we speak now, and there was no electricity in the last week. They have been doing operations and keeping the ventilators in ICU by the solar panels. And we do get message from them, they have no supplies, no food for the patients. So they want some help, not for them. The nurses and doctors, they themselves, they haven't seen their families for almost 10 days in Rafah. They don't get any security clearance to leave the hospital. Hospital is not evacuated yet, like Al-Shifa, but there are tanks just around the hospital, in the perimeter of hospital. So they are in a kind of, they're just hanging there. They're taking care of the patients, whoever comes in, but the patients have no food. So we get messages, please send us some money. We want to buy food for our patients. They're not asking for themselves. So please think about that.
I'm retired, so I don't have to worry about changing my practice. But I will it is just one reflection that Zahir and I, when we went into Aleppo, we talked about bearing witness. And that happened. But it has never really happened to me until this trip. I can't describe what I saw. I had some form of personal experience that has changed me. This has been an experience from which to say I won't recover is an exaggeration. I've already felt myself distancing a little bit, intellectualizing more than I should. But it is something that has become a commitment to me. I'm too old to see the end of this. I realize that. But every moment now will be dedicated towards some solution. So although it doesn't change practice, it does change my life. So thank you.
I believe in that. At one moment of, I don't remember whether you still remember this, John. John mentioned he has been to many, many conflicts around the world. He said he never developed hatred of the oppressors like that there in Gaza. So it was so brutal.
And with that, we are going to wrap up our program. I'd like to thank everybody for coming and for spending your Friday evening with us. Please, when you're making your way out, please be as quiet and as gentle as possible. We have other programming going out throughout the masjid. And for the sake of our neighbors, Jazakallah, and thank you all for coming.
On my knee.